Let's quickly talk about the concept of endocrine hypertension. Now, when you talk about endocrine, they are simply talking about your hormones, like something relating to your hormones, all right? So if they say endocrine hypertension, they are simply saying, okay, somebody has hypertension and the problem is actually from the hormones, all right? So you could see that the adrenal gland can have an effect on the heart, the pituitary glands can have an effect on the heart, that's the hormones they produce. The thyroid gland can have an effect on the heart, okay? And all the hormones, right, can actually have an effect on the heart. So let's look at this concept of endocrine hypertension under definition, the types, the causes, the symptoms, okay, diagnoses, and everything that has to do with this endocrine hypertension. For the definition, we see that endocrine hypertension refers to what? High blood pressure. And this high blood pressure is caused by hormonal imbalance, okay? So the hormones in your body, they are not balanced. Okay, they are not balanced. That's what resulted to the hypertension. So because they are not balanced, it affected the endocrine system. Okay. So types of these, we have primary aldosteronism. That's what Conn's syndrome. We have Cushing syndrome. We have what Pheochromocytoma. All right. It could be hyperthyroidism, elevated levels of thyroid hormone. It could be hypothyroidism, that's depressed levels of thyroid hormone. It could be hyperparathyroidism, that's elevated levels of what? Parathyroid hormone. It could be acromegaly. Acromegaly, that's something having to do with the um, growth hormone. Okay, so growth hormone, you have elevated levels of growth hormone after the person's bone has basically what? Ossified. Okay, so you have acromegaly. Now, looking at the causes, yes, it could be that the hormone is excess or deficient. Okay, if we're saying endocrine hypertension, we're not only saying the hormones must be excess. No, sometimes the hormones can be deficient and you can see result into hypertensive problems. Okay, could be adrenal gland disorders, could be pituitary gland disorders, it could be thyroid gland disorders, it could be what? Parathyroid gland disorders, it could be genetic mutations. What are the symptoms? If there is an endocrine hormone disorder, the patient could be complaining about things like what? Headache, dizziness, all right, fatigue, weight gain or weight loss, right? It's not one-sided. Mood changes, sleep disturbances, and what? Low levels of potassium, that's what? Hypokalemia. How can you be able to diagnose such a patient? You bring them to the clinic, you listen to their own story. Okay, that's a medical history. After they are done, you now try to find out for your own things, right? That's physical examination. There's some laboratory tests where you're checking out for hormone level measurement, electrolyte panel, renal function test, imaging studies like CT scan, MRI. Okay, all of that can be indicated. There's some confirmatory tests, can basically you are doing now, you can be doing specific tests. If it is adrenal gland, I do specific tests towards it. Pituitary gland, do specific tests towards the hormones. Thyroid gland, you do specific tests towards what? The thyroid hormones, right? Treatment is basically medications like aldosterone antagonists. Okay, that's if it is aldosterone that is elevated, beta blockers, angiotensin converting enzyme inhibitors, calcium channel blockers, all of this. Then you could also do some surgery interventions like adrenal gland removal, pituitary gland removal, thyroid gland removal, that's thyroidectomy, right? Then hormone replacement therapy can also help. Complications. This could lead to cardiovascular disease, lead to stroke, lead to kidney disease, lead to what? Weak bones, that's osteoporosis, lead to what? Electrolyte imbalance. Okay, so that's it for this endocrine hypertension. See you guys.